I'm Dr. Mike Nyack, a board-certified facial plastic surgeon in St. Louis, Missouri, and I've been performing facial plastic surgery for about 20 years now. Patients that come in to see me, one of their greatest fears is that they might look funny after surgery. And it's also one of the greatest fears of their spouses or their adult children. And they'll say, listen, I want to look better. I don't have to look perfect. I just don't want to look funny. And then they'll often go off into a little bit of a tangent where they name whatever celebrity of the day has been recently seen looking absolutely terrible. And they'll say, I just don't understand how this happens. They're celebrities. They have the access to the best of everything. They have money. How do they end up with these terrible results? A lot of times the patient or the patient's spouse thinks it's because either they went to the wrong doctor or a doctor is taking that celebrity for a ride. They're not able to say no because it's another check and it's another check and it's another check, and it's kind of putting greed ahead of the celebrity's best interests. Knowing a lot of these docs, knowing what happens behind the scenes, and being a practicing surgeon myself, I can tell you that's usually not what it is. What's really happening is when we sign a patient up for surgery, we're very clear, I know all my friends are, that we expect improvements. We don't expect perfection. We expect one side to be slightly better than the other. We expect to see 80 or 90% overall improvements. And at the time of the consultation, the patient is very understanding. Oh, I get it. I mean, it can't be perfect. I know no one's even. No one's perfectly symmetrical. Now, fast forward 6 or 9 or 12 months, and you get exactly what we expected. It's 80, 90% better. One side's slightly better than the other. There's an odd tension. They come back and go, you see how right over here it's not quite as good? Or when I put my head like this, there's a little bit of bunching. Can we just push that a little further? Just a little tweak. And it's hard in that circumstance to say no, because now you have a person that's invested time and money and energy and recovery, and they're not completely happy with the result, and they're maybe not completely happy with you. Sometimes they're even a little bit threatening, and especially in the celebrity situation, it shows up on camera, and this is my career, and I have to look perfect. And it can be hard to say no in that circumstance. And so you kind of hold your nose and you hope for the best, and you try to make it a little bit better. And sometimes it works. It's still not perfect, but sometimes a little bit better. Most of the time in that circumstance, you push the envelope a little bit and something funny happens. It doesn't heal exactly right. You have a complication, and you go from an A- result to a B. And now you're trying to chase what you already had. And now they're really mad. It looks even worse, or there's something else that's popped up. So you chase that a little bit, and something else goes wrong, and now it's a C. And now you're actually just trying to regain the ground you had on the first procedure. And the more time the cycle goes, the more upset the person is, the shorter time they want to wait between revisions, which is a recipe for bad revisions. And it becomes this awkward tension. And that is, in my opinion, how the vast majority of bad results happen, is that it was pretty good to begin with. You're searching for perfection, and you end up losing ground because the more times you operate on tissue, the worse it gets. The other thing that's hard, especially with celebrities, is it's hard for a celebrity to disappear until a final result becomes evident. So on a lot of these procedures, it can be 3, 6, 9, 12 months for a truly final result. Most people are passable at 2 or 3 weeks. Final result 6+ months. So that means there's an awkward window right in the middle. You're passable, you can go out on the street, but you're not your final result. Now in a celebrity, you're seeing them in HD, you're seeing them from 16 different angles, all the paparazzi. A lot of the celebrities that you catch looking terrible after plastic surgery, they're not in the state where you really should be judging that result yet. As a matter of fact, if you have plastic surgery, you might be passable at 2 or 3 weeks, final results 6 or 7 months. Don't judge your own results at 1 month or 2 months or 3 months. It'll just lead to dissatisfaction. So in my opinion, most of the times that celebrities end up not looking great after plastic surgery, it's either early result or it's probably should have left well enough alone. So if you go into your surgeon after your surgery with an overall good result, 80 to 90% better, one side slightly better than the other, and he says to you, look, we should leave this alone, he's not being lazy, he's looking out for your best interests. Hit that subscribe button to be notified of my regular content updates, and follow me on Instagram @Nyack Plastic Surgery for daily insight into the world of facial plastic surgery.